And so here we are. What I would like for everybody at home or watching this from wherever you're at to know is that if you can hear me, that you should certainly be turning your volume up. And secondarily, if you have any questions, you can hit the Q&A button, and I will save the question answering for the end. So what we have here is our very first slide. So our goal here is really to explain how stem cells solve pain. And I'm Dr. Richard Kim, and this is my practice here at Richard Kim Medicine. We have our first question, and we'll start off with a couple of first questions to just give you an idea of what sort of things people are looking for. Barbara R. said from area code 518, my spine's collapsing, had surgery at C3, C4, and at L5. Neither were fused or stabilized. Age of 75, wants her legs back. Father was a physician, heard about wonderful things about regenerative medicine, and especially what they can do with growing in animal parts. So looking for what Richard Kim Medicine can do, and specifically what regenerative medicine can do. So for us, what we intend to set some guidelines here, we want to talk about what regenerative medicine is. And specifically for us, we really think it's nothing short of amazing. While it is not a miracle, we certainly think that there is some amazing science in it. And has an absolute potential to help people in a really big way. But we also really want to talk about who specifically regenerative medicine helps. So you may be thinking about, is this something that is even for you? And you're here to learn and understand a little bit more about that. Mitra H from area code 514 asked, how successful is stem cell therapy? Is this covered by insurance? If not, the cost, is it FDA approved? Is a referral necessary? So again, stem cell with an amazing potential with non-surgical means, no medication means. It's a fairly minimally invasive method for solving pain, and also for just some logistic issues. No referrals needed to come see us. If you call, you can schedule your own appointment, etc. We as patients, and myself being a patient as well, we have some common goals, and we all want the same things. Number one, we want to avoid surgery. Number two, we want to stop medications. And number three, we want to improve our quality of life. However, when we would do that, we want some common goals. We want a plan. And we want that plan to be safe. We want it to have as low a risk as possible. We don't want prolonged recoveries, and of course, we don't want pitfalls. We don't want these sort of unwanted effects. And regenerative medicine is one of these types of solutions. Here is a couple of familiar examples of patients who've been to us and how they've turned out. Number one is a retired psychologist who flew airplanes for a hobby as a runner, competitive, but also used it for stress relief. And the back pain essentially ended running. That meant no more competition, fun, stress relief, limited its flying time. So a real downer in a lot of ways. Second, we have this chef who really enjoyed spending time with family, but was in constant motion, moving heavy restaurant equipment, affecting his work life, affecting his work day. And he was to the point of contemplating changing careers. Now, the majority of traditional therapies we feel like are missing the target. And what do we mean by that? Well, we mean that the surgery, oftentimes, when you look at that as an option, it's permanent. It's invasive. It has an incredibly long recovery, and so is not a viable option for a lot of people. Secondarily, medications. Medications have some shortcomings. For example, steroids are a band-aid. They weaken or they damage tissue. Therefore, if you do repetitive steroids, you can have repeat weakening and even repeat damage of that same tissue. Over-the-counter medications or OTC medication can certainly lessen symptoms, but we're talking about effects that wear off. And unfortunately, you have to then repeat the dose. 2 months after stem cell therapy, so our psychologist was back to running, ran the 4th of July 4-mile race in the 13-minute pace, confident enough to train for a half marathon with his grandson. We thought that was a pretty big victory there. The chef was back at working full time, able to provide for his family, able to get through his workday, and quote unquote living normal life. The goal of much of what we do is to break this cycle, and that's going back and forth between pain leading to degeneration and then degeneration leading to more pain. So this is the cycle that we're looking to avoid. We're really the third solution. If you said medications is one, surgery is the other, and we're that third solution. And what we're looking for is a really high success rate. We want to be able to find something that's going to have years of relief. And we want guaranteed acceptance. We want something that isn't going to be rejected by our bodies. The timeline here is a good example of what happens with our sort of biologic or regenerative medicine therapies is that it is progressively improving week after week. So it's not like one day pain's there and one day pain is not quite like a light switch, not quite yet. But what exactly is regenerative medicine? It's a new field of medicine. And its goal is to simply restore and not replace the areas that are damaged. We want that damaged tissue to turn into a healthy, functional tissue. We're utilizing different methods in order to make this happen. We're using platelets and stem cells. So PRP, platelets, is really great for the green and yellow circles. We'll say small to small medium problems. And then yellow and red is better for stem cells, meaning more sort of moderate to moderate severe type problems. This is a good videograph of what happens in actual cellular attack. The green is good, the red is bad. And the red is where you feel pain, where you feel stiffness and sciatica and all these other complicated symptoms that we feel. The cells attack that area and then obviously route out all that is bad. I like the Pac-Man analogy. If the pellets are inflammation, then Pac-Man eats the pellets one at a time. And that's something like what platelets would do. But what about many Pac-Man eating many pellets all at the same time? And that's more what stem cell therapy would be. The goal here isn't to just get to the next level, it's to beat and leave the game behind, the problem behind entirely. And for how long? We're talking about anywhere from 5 to 10 years. So a fairly decent period of time for a lot of our patients. Where exactly do the cells come from? Cells are coming from our pelvis for bone marrow, for example, and we'll be injecting it into the discs, and you can see where there's degenerated and then where there is then healthy disc. This is a basic timeline of our schedule and our process, which isn't always the same as everybody else, but it's initially the consultation, followed by the MRI, followed by the PRP, the first PRP, and then soon thereafter, we're doing the second PRP and the stem cell, the third PRP a few weeks after that. And then, of course, we launch into the physical therapy, the chiropractic care, and the exercise. And something that I often tell people is that while we can help and inject for pain, we can't really inject for strength. That you have to do, that you have to build. And that is something that with our counterparts in physical therapy and chiropractors and personal trainers are able to help restore for you. So where do we actually treat? Well, we're treating things like diagnoses such as stenosis, arthritis, degenerative disc, and sciatica. And so that means whether it's in the neck or if it's in the low back. Lower body pains, arthritis is a common one, bursitis, meniscus tears, Achilles tendon, And in the upper body, rotator cuff is certainly a common thing seen in our office. Arthritis, again, tennis elbow, carpal tunnel. And the question is, are you a Kenan? A lot of people want to know. Yes, but does this apply to me? We will essentially um, decide on what can be uh, a target for stem cell therapy based on whether or not it's injectable, whether or not it's operable. So if it's something that can be injected, well, we can put a needle there and we can inject these same therapies. And so that for us, that really includes everything from the neck all the way down to the toes and everything in between. Um, the important thing for us is always the diagnosis. If we have an accurate diagnosis, then we're talking about accurate location, and then we're talking about whether or not the therapy is going to be accurate. If you don't have an accurate diagnosis, you're not going to have an accurate therapy. For us, it's incredibly important to have that accuracy, to have that precision. So our therapies always include an MRI, and we are one of, if not the only practice who has our own MRI machine in order to ensure that we can get that level accomplished, that level of accuracy accomplished. What if you've had surgery? Sure, yes, still possible, but we would definitely need that consultation, that first conversation. And for us, during that time, making that diagnosis, getting that imaging is important, not just the history and the examination. We also want to see the type of surgery that you've had, whether it's an arthroscopy, a fusion of the spine, rotator cuff, etc. Some frequent questions. Where will my stem cells come from? So we typically take stem cells from one of two locations, either bone marrow or from fat, depending on the procedure that's being called for. How long before you can become active? For us, once we get to that final injection, once you get to that chiropractor, physical therapist level, visitation level, then that's the point where we get you to feel active. When do you start feeling the benefits? So we would probably say the majority, I would say 60% or more, start feeling the first benefits before that last injection. So from then forward, within the next, I would say, first 8 weeks after that second injection is probably a pretty good time frame. How long will the tissue stay repaired? So really depending on what we're injecting, what we're treating, that therapy can last anywhere from 5 to 10 years. So how well does this work? So spines differ than the knees and different than hips. The degree of arthritis does matter somewhat. The level of fitness matters somewhat. So this is a little bit harder to answer simply without having all the information. But we do know that it works well in the majority of the time. Not in all, but certainly in the majority of the times. Ian asked, is there a treatment, or from 518 asked, is there a treatment or procedure for degenerative disc in the spine? And so one of the things that we like to talk about it here is how a disc is really a jelly donut. And degenerative disc means that the jelly is leaving that donut slowly, versus when we talk about things like herniation, the jelly is leaving the donut suddenly. Stem cells help keep the jelly within the donut, versus something like surgery, where you use fusion to hold that donut in place, but really doesn't do anything other to the donut other than prevent further compression. Chris S. from area code 518 asks about simply degenerative disc. And again, this is a donut idea, jelly leaving the donut, that which leaves quickly versus slowly, herniations versus a degeneration. I will say this, over time, the degenerative changes of a disc get worse. I have yet to see a case where it's not either staying the same or getting worse. Or staying the same or getting better. In almost every situation over time, it simply gets worse. And that's pretty understandable when we talk about things degeneration. It's not a surprise to hear something like that. But for us, really resolving that pain has to do with restoring the function of that disc. And so that's what we're being able to accomplish with stem cell therapy, regenerative medicine therapy, and helping you to be more functional as a person. Kathleen S. asked from area code 518, how Dr. Kim's medical technology could be used instead of hip replacement surgery. So regenerative medicine certainly is the future. It's here. It's going to continue being the future. It's a minimally invasive therapy where you really do have a short downtime. We're talking about something that doesn't leave scars. You're not in a hospital to do it. Again, much like what we said before, it's about creating a much more functional hip. And helping you experience less pain, and of course more mobility, and keeping you more active in life. Ken L. from area code 518 says, if this is going to fix my back problem. So this is the part where, yes, this is what I experienced. Will this help? And so there has to have a conversation in between. And that conversation is, well, helping us understand what your back problem is coming from. So do you have a diagnosis? So if Ken has degenerative disc or has a herniation or simply joint arthritis, this is stuff we want to know. For us, the imaging is important early on, and that first conversation is so important. That's where we simply take your pain and turn it into a diagnosis. But once we have that diagnosis, which comes from, of course, the conversation plus the exam and the images, that's when we can start to put a plan together to fix your back problem. Maria M. from 514 said, degenerative disc due to osteoarthritis, slowly losing mobility, pain stopping me from doing various tasks. As time passed, pain is getting stronger. Prescribed Prolia injections every 6 months. So this is it, right? Degeneration gets worse over time. And we really feel like degenerative disc disease and other degenerative conditions traps many of our patients. Pain means less mobility. Less mobility leads to more pain. And of course, you bounce back and forth between those two things, and all the while doing less and less. If you look at ideas like surgery, typically mean fusion. This is a good example of it here. And of course, we've talked about in past webinars how important avoiding fusions are, because it can lead to things like adjacent segmental disease, which is then pain above and below, and trying to find a solution outside of surgery. And for us, a non-surgical solution lasts anywhere from 6 to 10 years. So some results we're quite happy with. Jeff W. asked from area code 315, I have a few conditions interested in finding out if I can get improved. Spinal stenosis, cause of his sciatic pain. Right knee with mild arthritis due to an old injury. Left ankle, which has quote-unquote end-stage arthritis from an injury in 1985. Hoping to reduce pain without doing an ankle replacement. Top interest being in the ankle. So osteoarthritis is a common diagnosis in both knees and ankles. So yes, you have pain, but Jeff has already helped us in establishing that diagnosis, knowing that he's got osteoarthritis. So it's a pretty common diagnosis in knees and ankle. For us, when people say that it's end stage and at the point of ankle replacement, what's important for part of what we do is your imaging, whether or not you've had any, whether or not you're going to need any. If you haven't, that's okay. Starting with the consultation is what we want to do. As I've said before, we have the ability to have our own MRI. So getting that imaging is less of a concern. But of course, if you have it, we'd like to see it. We want that story. We really want to be able to assess your function. We want to be able to examine that ankle, that knee, that spine, and see how much you're limited by some of these injuries. And that gives us a much better idea in terms of what level of therapy, what kind of therapy, how long is your therapy going to take, helps us understand all those things. And of course, stenosis, we've talked about numerous times here and in prior webinars, but is something we treat quite commonly. And so, yeah. Margaret S. from 518 asks, how long do the results last, and can it help arthritic knees? Again, OA, common diagnosis. Again, for us, a very similar schedule to the 3 injection series that we've showed you in the past. So 3 injections, typically over about a 6-week period. William B. from 585 says, I have a torn L405 disc, and can it be repaired via stem cell? So for us, when we hear the word torn disc, we're typically thinking of something called an annular tear. And that's usually a tear in the donut, and that means that the jelly is quote unquote leaving the donut, and that leaves you with a herniation when it leaves quickly. And of course, if it's a slow leak of jelly, then something we consider degenerative. Very common source of pain in our patients. So for William U, yes, we've treated many annular tears, torn discs, and have seen excellent results via stem cells. Deborah from 315, can stem cell injections help with basal joints arthritis of the thumb? So also detailed information about the procedure and the cost. So for those who don't know, the basal thumb is at the base of the thumb there. Pretty common site of osteoarthritis, something we treat pretty commonly. Also a similar process, 3 injections, typically over 6 weeks. Very frequent, especially in those who led pretty active lives or have a pretty decent family history of arthritis. Consultation would absolutely be the next step. We want to see you. We want to see how much strength you've got, how much function you've got in that hand, and obviously get the complete story. Kevin K said from area code 518, can you help with spinal stenosis? So if you can think about the foramen, or where the nerve travels through, that's the tunnel. And stenosis basically means that the tunnel is getting closed on the nerve. And the nerve, let's say, is the train passing through that tunnel. The disc is what's holding that tunnel open. So when your disc degenerates, your tunnel is getting shorter and shorter. So obviously a fact that a nerve does not like. Elaine from 514 said, how does stem cell help with the spinal stenosis? So this is a continuation question from the one prior. Stem cells help restore the disc quality, meaning that it can hold that tunnel open better. Maybe not perfectly. It's not going to make you 15 years old again, but certainly help that tunnel stay open such that the nerve functions much better, much cleaner. When we're talking about something that really lasts years, and so that's an important timeline to think about when you're thinking about all of these different therapies such as surgery and medications. Stenosis is something that we quite commonly see. Deborah W. from area code 315 said just simply knee procedure. So knee procedure, Deborah, I'd like to know if we have a diagnosis. The diagnosis changes the treatment plan. It changes whether you have arthritis or tendonitis or bursitis. I'd like to know. Mark S. from area code 518 said, how effective are your stem cell treatments for knee pain? Again, so knee pain is an important thing that you feel. For us, we have to have that diagnosis. The diagnosis changes the treatment plan, whether, again, arthritis or bursitis. However, if in both Deborah and Mark's case, knee osteoarthritis is the diagnosis that we're thinking about, I will tell you it is one of the most studied and well understood joints when it comes to stem cell therapy. It's something that certainly we do a lot of. It is one of the most common, if not the most common, stem cell for us. In fact, we did several today, just to give you an idea how common it is, and I think we do yet another one tomorrow. Nicholas C. from 716 says, do you prefer using stem cells locally to the injury site or systemically via IV? So secondly, do you see utility in using PRP in conjunction with stem cell therapy? Is the PRP a scaffold for the stem cells or more of a food source? So I will tell you that there is no IV stem cell therapy for the sort of medical issues that we see. There are IV stem cell therapies for, say, more transplantation-based pathologies and hematologic problems. But for us, when we're talking about back pains and knee pains, there isn't an IV-based therapy. So for us, it's all local. So stem cells have to be introduced local. Direct placement with image guidance, which is what we do 100% of the time. For us, PRP is in conjunction. We find PRP to be the signaler. So if you can imagine stem cells as the troops, PRP really is the general that helps decide what these troops should be doing. Corrine P. from 315 says sciatic nerve damage from epidural anesthesia. And I'm sorry to hear that, Corrine. That sounds unfortunate. For you, I'd definitely like to just kind of move quickly towards the consultation. I really want to understand what was injured, how badly was it injured, what sort of imaging you have, what sort of imaging should we be getting in order to help understand how much nerve damage came from that. So we want this as the consultation as a moment where you can, for us to understand you, and of course as a moment for you to understand us. Henry R. from area code 315 says backache with nerve pain. So one of the things that we want to know is when backache is not just backache, and of course when there's nerve pain. So that time and nerve damage is closely linked. The longer you've had nerve damage, the more likely it is to be permanent. So we need to understand whether that nerve pain is recoverable, whether it's temporary, etc. Perry B. from area code 518 said, will stem cells repair sciatica caused by an L5 pinched nerve origin injury? I'm assuming original injury, January of 2023. So here's a good example too of a diagnosis versus a symptom. Sciatica, unfortunately, is just a symptom. It's not a full diagnosis. So we want to know, why is there a sciatica? So for something like an L5 pinched nerve, that sounds like it could be stenosis. It could be a herniation. It could be degenerative disc disease. A part that we're going to have to certainly understand by discussing with you, getting more into your history of your symptoms. But obviously, coming from conversation plus exam plus all the images, and we can help understand where that's coming from, and then give you a better idea of, well, stem cells can help this, but not these sorts of things. So that first conversation is quite important. Samantha C. from area code 352 said treatment for pain and discomfort from neuropathy in feet and senior citizens, likely compounded by severe canal stenosis. So nerves are wires simply from the spinal cord down to the muscle or down to the skin. And of course, you can have temporary versus permanent damage, which we alluded to in the past slide. There's some factors that we really need to understand for you. So which of these are permanent, which of these are temporary. And then treatment would be the next step. And for us, sometimes we won't know what was permanent and what was temporary until you do the treatment and time passes. And unfortunately, it's limiting in that way. But nerves respond so slowly that really time is one of our most important factors in looking at success of therapies or recoverability of nerves sometimes. But Reed U from area code 514 said sciatica therapy. Again, sciatica is a symptom, but this is a good chance for us to talk. Let's have a conversation. Let's understand the exam. Help me understand what your exam shows, what your images show, and then discuss as to exactly where along this wire we find that this sciatica is, or this sciatic nerve is creating this sciatica. We want to understand these kinds of things. Dan S. from area code 518 said basic information then to build knowledge based on. So we hope that throughout this, you saw some of the science, get a brief overview of the science. Secondly, we hope that you see what our process is like and how that might be different from other people. And lastly, whether or not, the results of a practice like ours. We've been doing this for 10 years. Obviously, we're pretty experienced with all matters of regenerative medicine and all sorts of diagnoses as well, whether they're from the cervical spine all the way down to your big toe. Denise from Ferret 518 said, I have degenerative disc disease, arthritis, stenosis, etc. in my spine. What can you do for me? Do you accept Medicare, Blue Cross, Blue Shield of Massachusetts, PPO plan? Was this hairstyle for almost 50 years. What can you do for me? So very common for us, degenerative disc, arthritis, stenosis, very common diagnoses. And hopefully from the prior several slides, you heard about our process and what that's like. For us, unfortunately, they're not just us, but for everyone in across the states here, there isn't any commercial coverage for the types of therapy that we do, and it's one of the sad and unfortunate limitations about our healthcare system currently. John L. asked from 438, chronic pain, musculoskeletal, and fascial. So hopefully we're able to answer some questions. I saw some options as to treatments and treatment and therapy types that are out there for you, not just medications or surgery, but really for us being able to stress and for you how important it is to put pain into a diagnosis. And so the better we understand your pain, the more accurate we are with our diagnosis, which means more accurate with our therapy, and then going from there. All right. So that concludes our webinar for today. Just wanted to make this offering for those who have shown up for today, is that anybody who's here can be offered a free consultation. Our only requirement is that you call by Friday at noon, is when the office closes on Friday, and mention that you saw us on the webinar. We'd like you to schedule a consultation and then come meet us and go from there. Our next webinar, if you are interested in catching another one or want to share this with other people, is September 25th. Our two main phone numbers are 518-871-9900, and for all our Canadian folks, 514-697-8919. You can find us at richardkimmedicine.com. And /webinars for future webinars, or /MRI if you're interested in scheduling your own personal MRI. Okay, so that concludes what I have to share with everyone today. And if there's any questions, happy to take a question. I'll give you guys a couple of minutes, and then otherwise, if not, I will conclude our webinar. Okay, maybe a quick in and out today. No questions coming up, but for everybody who arrived, again, thank you for taking the time to sit here and listen to me and learn a little bit more about our practice and what we do in regenerative medicine. Until next time, I'll look forward to seeing you guys.